From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. All right. Well, hey, everybody. Welcome to the Enhance Your Life podcast. My name is John Small. It is so wonderful to have you join us today. And my guest on this episode is Dr. Uwe Blesching. And Dr. Blesching is a medical writer, an author, and a speaker who specializes in the cannabinoid health sciences. He is the author of multiple books, all really great reads, including The Cannabis Health Index, which is now in its third edition, Breaking the Cycle of Opioid Addiction, and Your Cannabis CBD to THC Ratio. Dr. Blesching is currently the co-founder and chief science officer at Canon Keys 360, which is an app and an online platform that is designed to demystify the science of the endocannabinoid system. We could all use a little demystifying of this wonderful plant. Dr. Blesching, welcome to the show.
Thank you, Jonathan. It's a true pleasure to be here with you today.
So much to ask you because you're such an expert, but you also have a really interesting backstory, right? Tell us what kind of a doctor you were before you got into the cannabis field.
Actually, I wasn't a doctor. I was a paramedic who worked for the city and the county of San Francisco for about 20 years. And the good thing about being on a fireman schedule is you have a lot of free time on your hands. So while I did that for, about a couple of decades or so on a parallel track, I went to a university and got a PhD in research, especially with a focus on mind-body medicine and the cannabinoid health sciences.
Now, why did you decide to do that after 30 years doing more what we call like conventional medicine?
Well, you see, my first introduction to drugs, including cannabis, was working, for the city as a medic, and I've come to realize that the type of 911 calls that each of the different substances out there are generating, it had become a foundation for me to with which to discern, the kind of energy that is around a particular drug. And while I didn't know much about drugs initially, I became quite familiar with the effects they have on the very patients I encountered, on a day-to-day basis. So, I became to judge drugs based on, what kind of a patient would use them. And so cannabis, emerged as a substance, as a drug that hardly ever, I think I recall one event out of 20 years where somebody called 911 because of something that had to do with cannabis. And that was in association with another drug that they used in combination.
Right.
And so cannabis always, emerged as a relatively safe substance, which was quite contrary to, all the narrative on the war on drugs that I was raised with, or that, a lot of folks in medicine still think of as the basis for arriving at their discernment about, cannabis in general.
Oh, that's interesting. Were you, I know you're originally from Germany, so you also came with the same stigmas and stereotypes about cannabis, even though you've lived in this country for quite a long time?
Yeah, absolutely. And in fact, in Germany, there, especially when I lived there, there was no cannabis as far as what we come to think of cannabis mostly, which is flowers or flower-based extracts. If there was cannabis at all, it was hashish or keef.
Right.
That was the only form in which it came, and it was, hardly ever used. And so my exposure to cannabis, especially, was minimal. And I learned about cannabis from the patients that used it. Especially in the late 80s. When the HIV/AIDS epidemic hit San Francisco, especially, one of the things I quickly realized is the differences of patients that used cannabis to treat a variety of the conditions that are associated with HIV and AIDS, and those that didn't. And so there was a clear difference, a clear and noticeable difference in how each of these types of patients presented themselves when, in the context of generating a 911 call. And so, that was one of the first interesting observations. Is seeing the differences of patients and how they present if they had used cannabis as medicine or those that didn't.
What did you see of those that used cannabis as medicine? What did you notice?
Like, for example, peripheral neuropathies is a common sign and symptom in the HIV patient populations. And those patients that used cannabis to treat their peripheral neuropathies presented with significant less pain than those that didn't. The same is true for patients who used cannabis to mitigate the adverse effects associated with chemotherapy-induced nausea and vomiting, for example, or the pain and inflammation that comes from a radiation therapy when cancer were treated with ionizing radiation, and so it was remarkable to see patients, basically presenting with the same underlying pathology, with the same signs or symptoms, but are in a completely different place as far as them being able to cope with it, for instance. And it struck me early on, seeing and comparing those things. And that is what one of the things that got me started into looking at the plant in the context of medicine in the first place.
Yeah. So you changed the track of your life, the course of your life. You learned all about cannabis. You became an expert in cannabis. I have so many questions for you, but I think we'll focus this conversation a little bit today. I want to talk to you a little bit about dosing today, because I think a lot of people probably listening to this, including me, have questions about how to dose cannabis properly. And since one of your great books was called Cannabis CBD to THC Ratio, I thought it'd be interesting to sort of take a look at, how do we think about dosing? Because a lot of people don't have access to people like you, to doctors that can help them figure out how much to take. So they'll get a tincture, or they'll be in the dispensary and looking at the ratios of this CBD to THC, and they don't really know what they should do. So can we talk about the different doses that, first of all, the cannabis comes in, the chemotypes, right? And then also talk about a little bit about how to understand how much of a dose you should be taking. But first, let's talk about the THC to CBD ratios and how that all works.
That's a very good question, and we can probably spend a couple hours on.
Yeah, sorry, this is like a dissertation.
But it's, taking a bird's eye view, this is great. Well, first of all, I would say that there is no silver bullet approach when it comes to working with cannabinoid-based remedies, whether they be flowers, whether they be extracts, tinctures, edibles, whatever it is. It always has to be taken on a case-by-case basis.
Yeah.
And that means we do want to take, if you work with a clinician, or if you want to use your own past experience and bring that to bear, ideally you would want to have a brief review of the scientific literature that you can then use as a backdrop, as a context, to sort of like give you some ideas about, what has been discovered, regarding, say, if it's HIV, peripheral neuropathies, if it's nausea or vomiting associated with chemotherapy. What is it that you want to treat? What does the science say? What does your clinician experience bring to the table? What is your own experience, or even what is your preference about what kind of cannabis experience you wish to have? All of these questions are important questions. For example, if you have a patient, or if you are a person who is really concerned about cognitive changes, changes in cognition, changes in perception, in all the things that are commonly associated with getting high, which is a term I don't like to use, but to just just to use it because it's commonly out there. And so so if you are such a person who's concerned or who still wants to tap into a vast reservoir of potential therapeutic effects, you can in fact use a type of cannabis that contains very little or only trace amounts of THC, but instead contains high amounts of CBD, which is another cannabinoid, another plant constituent that bestows a number of therapeutic effects, but will not produce changes in cognition. It will produce a gentle uplift in your affect or in your mood, in the way you feel, but it will not produce changes in your perception, in your behavior, in your motor function, And so as such, it's a completely safe cannabis, a type of cannabis that anybody can use, anybody can drive, operate heavy machinery, no problem at all. And so first of all, it's important to know that people realize that there are different types of cannabis.
Yep.
And so there's a type of cannabis that will produce changes in cognition, and there's a type of cannabis that will not. And then there's lots of different types in between. And the difference is determined by the ratio of THC, which is the predominantly psychoactive constituent in cannabis, and CBD, which is produces a gentle uplift in mood, but no cognitive changes. And so the ratio between those two primary plant constituents, THC and CBD, goes a long way in producing the very specific effects that you want to generate, or goes a long way of preventing very specific effects you want to avoid. And so that's where the importance of the ratio comes into the picture.
I want to put a pin in that for a minute. You can buy CBD now that has no THC whatsoever in it, right? They call that an isolate, where they just isolate the CBD, and you can also get CBD where there's just trace amounts of THC, the legal amount of THC that's allowed to be with CBD, in order to be sold in non-legal states. And I'm wondering if that type of CBD, again, everybody's different, but do you need a little bit, like what ratio of THC do you need, if you need any at all, in your CBD, mixed with your CBD, for the CBD to have an effect?
Well, CBD will have an effect all in and by itself.
Okay.
But there is a synergy that is being generated when there are even small amounts of THC in there. So a lot of physicians that I know that have become specialists in their cannabinoid health sciences and treat a lot of patients with cannabinoid-based medicines, most of them actually prescribe a ratio, let's say a 10-to-1 or a 20-to-1. They always want to have a little bit of THC in there because there is something that happens when both cannabinoids are present, even if they're only in small amounts. And small amounts do not produce changes in cognition, but they do amplify a number of the effects that THC might have by itself, let's say an anti-inflammatory or an analgesic effect or an anti-nausea effect. And so there is something called a synergy, and that makes where the sum of its components is larger than each of the components individually. And so that's one of the reasons I always like or prefer personally to use full spectrum products rather than isolate, because there's a harmony, there's a symphony. It's like a concert. You can listen to a violin by itself, but if there is 20 other instruments and musicians supporting the melody of the violin, the whole experience becomes much more dimensional and much more useful, especially in the therapeutic setting. And so having said that, and so it depends on who you are, what your preferences are, and what specifically is it that you want to treat. And so, for instance, there are, and you mentioned the term chemotypes.
Mm-hmm.
There are three basic chemotypes of cannabis that are defined by their THC to CBD ratio. And let me give you let me briefly explain what they are and tell you a couple of the patient populations that the science has clearly indicated are optimal chemotypes for these types of patients. Because overall, that will illustrate the relevance of the ratio.
Right.
So a chemotype 1 is a type of cannabis that is predominantly THC with only small amounts of THC. And so patient populations that benefit from a chemotype 1 are, for example, patients who have withdrawal symptoms from alcohol addiction, from opioid addiction, withdrawal from methamphetamine, for example, withdrawal from benzodiazepine addiction. Any of the hardcore addictions, withdrawal effects are typically ideally mitigated by cannabis chemotype 1. So are patients with spinal cord injuries, patients with central pain syndromes, for example,
right.
Patients who are dealing with nausea or dealing with respiratory constrictions, like asthma, for example. All of these patient populations clearly benefit from a chemotype 1.
Right, which is higher in THC, lower in CBD.
Higher in THC. While a chemotype 2 is considered a relatively balanced ratio. It's somewhere between 4:1 and 1:4 is what's considered roughly in the literature as being considered a chemotype 2, containing relatively equal amounts of THC. And so patients with fibromyalgia, patients with primary and secondary symptoms to multiple sclerosis, for example, those are patient populations that clearly benefit from a balanced ratio. A chemotype 3 is a type of cannabis that contains only small amounts of THC and high amounts of CBD. So it would be a Charlotte's Web, for example. And patient populations that clearly benefit from a chemotype 3 are patients with, for example, pediatric patients who have seizure disorders that do not respond to traditional orthodox pharmaceutical anti-epileptics. So kids that have seizures that won't stop no matter what orthodox treatment methods are used. And so these types of patients clearly benefit from a chemotype 3, but also do patients with mood disorders, anxiety, depression. So there are PTSD is another good example that highlights the benefits in the scientific literature of the utilization of a cannabis chemotype 3, which is CBD abundant. And of course, anybody that's concerned about changes in cognition should start with a cannabis chemotype 3. And then if it turns out that they need, they're not getting the effects that they want, they can gently change the ratio and titrate and dial in, if you will, more THC until they find the sweet spot of their ratio that's optimal for that particular patient.
So let's talk about a chenotype 2, because that's an interesting sort of middle zone. Can you generally feel the euphoric effects of the THC in a chenotype 2 ratio?
Yes, and it's always dose dependent. And so if you take a 1:1 at 10 milligram of THC would also then bring in 10 milligrams of CBD, a 1:1 ratio. And so 10 milligram for some people is a significant dose. If I were to take 10 milligram, I would have a significant and most likely unpleasant effect because I'm very sensitive personally to THC. And, and you can't predict it, when it comes to pharmaceutical drugs, you can pretty much predict the effect for a majority of cases based on prescribing that particular drug on weight. When it comes to cannabis-based therapeutics, you cannot do that. Because the individual situation can differ even within the same patient population so significantly so that you always have to have a titration period. That is, you have to start low and go slow. If to use that old expression.
We like it around here. That's a good one. But especially when you're talking about edibles. Yes.
Yeah, and and ideally you keep a journal log. You keep you write down the ratio, you write down the milligram dosage, you write down the form, and you keep track. And if you hit the sweet spot right away, great. Stick with that formula. If you don't, then you dial up or down the primary cannabinoids until you find the sweet spot. And so sometimes people don't know, well, how do I know? And so this is where the use of the literature comes into the picture, or where the use of a healthcare provider that's experienced with the use of cannabis comes in helpful. Sometimes if you have a good bartender in a dispensary that has a lot of experience along those lines, they may also offer some advice in terms of how to how to dial in the optimal plant constituents that are going to be working best for you.
Is there a big difference, say, between a 4-to-1 CBD to THC ratio as opposed to a 10-to-1? Like sometimes you'll see the most random ratios on the packaging, and I don't know like I can tell the difference between a Chemotype I where it's 10 THC to 1 CBD, but when you have like a 4-to-1 and a 10-to-1 CBD to THC, I don't know, if I'm somebody who's very sensitive, say to THC, maybe I'll start at the 4-to-1 or at 10-to-1 and then go to 4. I just don't like, how do you know the difference when it gets those kinds of numbers?
Don't be too concerned about the ratio. Instead, look at the milligram dosage of THC itself. And so, because if you're taking a 4-to-1, for example, and let's say, to be consistent, when we talk ratios, I always try to use THC as a first number and CBD as a second number. It tends to be the standard, although in some states it differs.
Okay.
But just so as we move forward, the first number is let's always use THC.
Okay.
So if you're using a 4-to-1 and the milligram dosage of THC would be, let's say, 10 milligram, then the milligram dosage of CBD would be a fourth of that. So it would be 2.5 milligrams of THC. If it's reversed, if it's a 1-to-4, then your THC milligram would be 2.5 milligram, and you would be taking 10 milligrams of CBD. So here's the trick. Don't worry too much about the ratio, but make 5 milligrams of THC your red line.
Yeah.
That you wanna consider. Let's not do more. Especially for cannabis naive, for people who are starting out fresh. If you don't know your sensitivity level to THC, let 5 milligrams be your top. And if you're concerned about the effects of THC, start much lower. Start with half of that, 2.5 milligrams. Wait an hour and see how you feel. See, how your symptoms respond. And so for a first timer, and it depends on their levels of comfort with utilizing THC, start low and then, wait an hour, and then next day, if 2.5 milligrams didn't work, go up to 4 or up to 5. But 5 is what I would use as an upper limit for newcomers. Now, for the most part, most people tend to, and this is a bird's eye view, a generalization. It's not going to be true for everyone, but up to 10 milligrams of THC on a daily basis, let's say broken down into 2.5 milligrams 4 times a day throughout the day, produces mostly therapeutic results for most people. Now, having said that, there are some sensitive people who are having a negative reaction to even 2.5 milligrams. And so they might want to start with microdosing, which is roughly about 0.4 milligrams of THC, which typically for most people is the threshold where most people do not experience cognitive changes. But you can still feel subtle effects of THC. And there could be an anti-inflammatory effect. There could be a gentle uplift in mood. That could be a mild reduction in your pain. It could be, a sense of flow, a sense of creativity. You may experience that if you're sensitive at even 0.4 milligrams. And if you're really careful, you start at 0.4 milligrams and you gradually go up. You just gradually until you find the spot that works for whatever it is that you want to achieve. And that's what you stay with.
What is your advice to people if they should have that adverse reaction that you're talking about? We've all had it, right? I mean, I'm sure including you, where we just take too much by accident, or maybe we were experimenting and it didn't go quite the way we wanted. We're feeling, for lack of a better word, a little bit too high. There's so many sort of wives' tales about how to get out of getting too high. Is the myth, or is it a myth, that you should take more CBD if you're starting to feel those adverse euphoric experiences that are making you a little bit nervous and uncomfortable?
Here's what the science says. If you take CBD with THC, especially in higher ratios, there is a tendency to take the harshness that sometimes can come with the unpleasant THC experience, it might mitigate them. But if you're taking it after the effect, to date, I've not come across any of the studies that have indicated that it actually works. Once you cross that line, that fine line between a therapeutic and an adverse effect, it's just going to take time. And typically, depending on your sensitivity level and depending on how much you took, it may take a few hours. It may take up to 16 hours or 20 hours until your body normalizes and the unpleasantness goes away. There isn't an antidote. There's no such thing. For example, if you overdose on opioids, you stop breathing, we inject Narcan, and within 30 seconds to a minute, the body starts breathing again, and the crisis is averted. If you cross that line with THC into an adverse effect experience, there isn't an antidote that at this point in time. The best thing you can do is to reassure the person, to lower the lights, to play some calming music, and just reassure them that it's just going to take time. Just relax. I'll be with you, holding your hand, and just go with the flow and ride it out. There isn't. Even if you were to go to the emergency room, there isn't an antidote the emergency room has either. And so they do the same thing. They put you in a calm room. They lower the lights, and they have somebody come in and check on you, and reassure you once in a while. And so there isn't much of a difference in the clinical setting or what you would be able to do at home. And so reassurance and time is the only remedy so far for a THC-induced adverse experience.
I want you to take a little moment to tell me a little bit. I mentioned at the top of the show that you have an app called Canon Keys 360 that you co-founded. You're the chief science officer of this app. Tell us what it is.
Well, I when I published my first book, The Cannabis Health Index, the first edition, about in 1914. I found enough of scientific literature to make the case for the use of cannabinoid-based therapeutics for 100 and plus chronic conditions.
Did you say 1914? I think you meant 2014.
No, I'm sorry.
2014.
Did I say if I did, I meant 20.
I was like, you're a time traveler. Okay, 20. All right.
This is funny because I just inputted a great number of studies from the late 19th century that are fantastic in the early trends that even the physicians of the early 19th century discovered utilizing tincture of cannabis and the patients that they treated. And it took 100 years, pardon my sidetrack here for a second, but it took 100 years for us to rediscover it, and for the applications that they are now being used. A lot of physicians started using them in the previous century. But besides the point, to get back to 2014,
right? In
2014, I could make the case for 100 plus patient populations that could benefit from the use of cannabis. Only 4 years later, when I put out the second edition, that number had significantly risen to the place where now the third edition is out, and I'm covering over 200 individual conditions for which the use of cannabis shows therapeutic promise. Now, there are about 10 trials being published on a daily basis that give us more information, especially clinically relevant information about the use of cannabis in the clinical setting. And so the rapid speed by which the cannabinoid health sciences are growing is enormous. And so while I still like writing books and learning from books, holding a book in my hand and flipping through the pages, there's something to be said for learning that way. There are a lot of patients, there are a lot of healthcare providers, nurses and physicians and researchers that need access to the latest context, utilizing all the studies up to what was published yesterday. And so you can't do that in writing. And so to remedy that, my two partners, Doug Reel and David Rosenthal and myself, we decided to create an online version that takes all of the scientific literature that's been published about cannabis and about the system in the human body that responds to the use of cannabis, and curate them in such a way that it's really easy to get the most important pieces of information at your fingertips, so you don't have to spend hours and hours doing all the research by yourself for every patient that you see. And so we designed it to be a useful tool, a time-saving tool to read through, this enormous body of literature and the fast pace by which it's growing, so that people can have access to it and make more informed and discerning decisions if cannabis is thought to work for what ails them or for what ails their patient, and what type of cannabis, what dosage points are showing up in the literature that's thought to work most effectively, and what are the things to be concerned with, the warnings, the contraindications, and the care that needs to be taken into account when you're using other pharmaceutical medications, because they may interact with each other. And so to have all this information at your fingertips, what I used to do in the Cannabis Health Index, we now have an app, we now have an online version that is up to date for those people that want it and for those people that need it.
No, I'm so glad you're doing this. There's definitely a feeling, maybe falsely in the community, that there hasn't been enough research in cannabis. And I'm sure there's always more research to be done, but there actually has been quite a bit of research done on cannabis over the years, as you've mentioned, and it's great to have it all in one place. And do you update this regularly?
Yeah, we update it on a virtually daily basis, and so there's always new studies. Like I said, about 10 or so being published on a daily basis, and so we have a team of folks that identify these studies and input them into the data bank, so that we can provide them with the latest up to date information, and so yeah, virtually on a daily basis.
All right, so it's called Canon Keys. I have it up on my computer right now. You can have it on your computer, but it also comes as an app.
Yeah, you can use it on your iPad, on your handheld device. Yeah, and there'll be an upgrade coming soon, so it'll be optimized for smaller devices. But it's work in progress. But check it out.
I can't wait.
For those of you that are interested, there's a free subscription. You can try it out for a week and pull out the information that you need. Or if you want to spend more time with it, and if you find it useful, please subscribe.
Dr. Uwe Blesching, thank you so much for taking the time to talk to us about all this today. You're such a wealth of information. I really appreciate it.
It was my pleasure. Thank you for having me.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to wanabrands.com. That's Wana, W-A-N-A, brands.com.